Traditional cut and sew periodontal surgery treats the effects, Tom mentioned this before, and not the cause of the disease. Theoretically, there are pockets and the bacteria are in the pockets, and the theory is that if you eliminate those pockets, you're going to be better able to clean the teeth and therefore prevent the progression of the disease or the disease itself. But in reality, what happens is when the gum is cut away to the depth of the pockets, first of all, you end up with painful surgery, and it leaves the patient frequently with long, sensitive roots and large spaces between the teeth. The result is, in effect, that it's more difficult to clean now than it was before. And that's the reason, I believe, why we frequently in the past saw patients coming back after 2 or 3 years, and they had the disease again, and they're going to go through surgery again. That offended my sensibilities from day one. Literally, 80% of the people walking by the front door of my office today have some degree of periodontal disease. Get it checked out by a competent periodontist. Focus on treating the causes of the disease, not the effects. This is really essential today, given what we know about the relationship between gum disease and overall health. You are doing yourself an incredible injustice if you aren't having this sort of thing checked out. And it's simple, non-invasive, not painful, easy to do.